Welcome to Behind the Counter with NJSHP, a podcast for pharmacy students where we interview current pharmacists and talk about topics in the pharmacy world. I'm Connie. I'm a P1 Public Relations Project Chair at Rutgers NJSHP.
And I'm Shiloh. I'm also a P1, and I'm the other Public Relations Projects Chair at NJSHP.
And today we'll be interviewing Dr. Meyers. So if you would like to introduce yourself.
Sure. So I'm Rachel Meyers, and I'm a faculty member at the School of Pharmacy at Rutgers. And I am now in my 18th year at Rutgers, and I'm a clinical faculty member. So that means that I spend part of my time teaching students, but then also a lot of my time in my clinical practice, which for me is at Cooperman Barnabas Medical Center in Livingston, New Jersey, and where I am the pediatric pharmacist.
Awesome. So tell us how you got to your career today. Like, what was your career path?
Sure. So when I graduated from high school, I went to college thinking I wanted to be a veterinarian. My dad is a veterinarian. And then I sort of figured out pretty quickly that that wasn't really the lifestyle that I wanted. It didn't think it feel like a right fit. So I bounced around majors. And then one summer, my dad was working in pharma at the time. And so I got a summer position for college students working at a company which is now part of Bristol Myers Squibb, and met some pharmacists there and, started thinking that maybe pharmacy would be a good career path. And I liked pharma. Obviously, I didn't end up there, but that's how I got started, is sort of this interest in pharma. So I ended up finishing my bachelor's in biology and then applied to transfer. That was at the University of Mary Washington, which is in Virginia. I'm from Pennsylvania originally. I got my bachelor's and then applied to transfer into pharmacy schools and ended up at the University of Connecticut and really enjoyed my time there. When I was a P1, I wanted to get a job in pharmacy, and they had like a job fair for the P1s. And I passed out my resume, to a bunch of different places. And the place that called me was the Children's Hospital in Hartford. And so I went in for an interview and ended up taking that job. So for most of my time in pharmacy school, I was a technician at Connecticut Children's Medical Center in Hartford. And that's kind of what got me interested in working in a hospital and pediatrics specifically. And so, yeah, that's sort of what made me kind of change my mind about what part of pharmacy I wanted to be in. So when I got to be a P4, I did, obviously a lot of rotations, but one of them was at Dartmouth in New Hampshire in pediatrics. And so my preceptor there, he and I are still friends. We still text. We still have lunch at the pediatric meeting every year. So he was really great in terms of just guiding me on this process. So I did my first year residency at the University of Wisconsin. That was like a big leap to go out to the Midwest, but it was a great year. Made a lot of really good friends there who I'm still in touch with. And then I did my second year of residency, specifically in pediatrics at the University of North Carolina in Chapel Hill. I did my pediatric training there and loved it. Another great group of friends that I'm still in touch with. And then, it was time to look for a real job. And I interviewed at a few different places, but one of them was Rutgers. And I wound up here, and I really, liked the idea of the academia position that was also clinical in nature and allowed me to practice as a pharmacist still. And here I am, still here. So
As a technician, you're not like too involved in kind of the clinical side of stuff. So
mhm.
how did that kind of shape your idea
Yeah.
of pediatrics?
What is different about Connecticut Children's than really any of the hospitals in New Jersey that treat children is they only have children. It is a true children's hospital. There's no adults. It is connected by tunnels and bridges to Hartford Hospital, but it is a standalone entity. All they do is peds. So, obviously I was learning things like how we make doses for different weight patients and how they're not all the same doses like they are for adults. And I think also the pharmacists were really good at sort of taking us under their wing, all the students. There were like 4 of us or so that worked there. And they would kind of tell us, oh, that, medication you made this morning for that patient, he's doing really well. And, they sort of would give us information. And I also, one thing just to note, like why it's so good to have a good boss and a good mentor. There was a grand rounds one time, which is basically like a lecture, it's a weekly lecture for the residents, the medical residents, but it was on medication safety by a national expert on pediatric medication safety. And so my boss, the director of pharmacy, he was like, "Hey, you should come to this." And like, let me step away from my job responsibilities to attend this lecture because it was obviously relevant. It was a pharmacist, and they were talking about pediatric med safety. And I just think like there's a boss, and here I am, this lowly student. Like, not that students are lowly, but you know what I mean? Like, I'm like the lowest on the totem
Right.
pole,
Uh-huh.
right? And he was looking out for me, and you know what I mean? And made it possible for me to go to that lecture. And I ended up talking to that pharmacist for a little bit afterwards. And he was from like near where I grew up. And so we ended up arranging when I was home for winter break. I went to visit him at his hospital, and like he gave me a tour and we talked about pediatric residencies. And so I think like the sort of theme here is that find good people to work with and good mentors that will look out for you, and it can help shape your career.
Yeah. No, that's so sweet. We definitely like learn it a lot in class too about like mentorship and everything.
Mhm.
Talking more about your career as a pediatric pharmacist, what is your role or like what's like a day in the life for you?
So usually in the morning, I come in and I'm looking at the patients, especially the ones that came in overnight, and checking their medications. And I'll follow up if there's any drug levels that I ordered, that kind of thing. And then at 9 o'clock, we have rounds in our pediatric ICU. So I attend those. Right now, I have a pharmacy resident on rotation with me. So she and I actually meet from 8 to 9 to go over patients. And then we have rounds at 9. And then once the ICU rounds are over, then we go over to the general pediatrics rounds, which usually go till about 11 or 12. And so we're just, walking around room to room with the physicians and nurses and other members of the healthcare team. And we're going over every patient. In the PICU, we also include the families as well to make sure we answer their questions. And sort of things that I do is bring up, pharmacy related problems. Like this morning, I noticed that one of our patients that we got from the OR yesterday, he had a certain type of IV catheter in that usually requires heparin to be in that catheter, and there was none ordered for that. And so that means it would be at high risk of clot. So the doctor agreed with that, and she ordered it, and the nurse changed the fluid in that line to the heparin containing fluid. Other times, like yesterday on rounds, we have a patient who has a bone infection. And I noticed that the bug, like the culture from his wound, it actually kind of finally came back, all the results from it. And so we were able to change his antibiotic therapy to more adequately meet the needs of his infection. So I made my suggestion to the team, and then I saw the infectious disease doctor. So I flagged him down and we chatted about it. And then the patient has an allergy. So we talked about the most appropriate options for the allergy and that kind of thing. So that's sort of my morning. And then usually my afternoons are different meetings. Yesterday, we had our antimicrobial stewardship meeting for pediatrics for the whole health system, in which I help provide some data for that. Then, like today, after we meet, I'm meeting with my pharmacy resident to go over just basic. Yesterday was her first day. So we're talking about pediatric pharmacology and kinetics and things today. So, and then usually, I have time for working on projects. I emailed the physicians today about an update to our electronic medical record, something they had been wanting within the ordering process. Went live today, so I let them know about that. Every day's a little different. So, and I
Very
don't have
busy.
pharmacy students now. So if I had pharmacy students, I'd be meeting with them and they'd be rounding, and we'd be doing some teaching in the afternoon as well.
Mhm. A question for the round. So you mentioned that usually the parents come along or the parents come when you're doing rounds, but how do you like try to get the kids involved in it? Like do Do you kind of try to explain to them
If it's a
over?
teenager, they'll start by like actually we'll go in the room as long as it's appropriate to do
Mhm.
so. And, we'll ask the teenager, why are you here? What's the
Right.
plan for today? And we definitely include them front and center. Obviously, if it's a littler kid, it's harder to include them. But yeah, definitely if the kids have questions, we will answer it. And of course, the physician and the nurses are there all day as well. We like to do family-centered rounds in our ICU so that the nurses and the patients know what the plan is for today and they know that we're, communicating with them, and they're part of the group.
I guess since you like mentioned working with kids and even teenagers sometimes, like what are the positives and negatives sort of like working with like younger children?
So I always joke with my adult pharmacist colleagues that like their patients are sick and then they go home and then they just come back again. And I like the resilience of kids. They can get really sick and a
Mhm.
lot of it is such bad luck stuff. But most of the time they get better and they're back on their feet. And yeah, and it's just like it's a happy place. When it's sad, it's really, really sad. But most of the time it's a really happy place. And yeah, kids
That's
show a
great.
lot of resilience and we like that.
Yeah. When my niece was born, she had COVID. That was like at 1 month. And
Okay,
I,
wow.
I, I was very scared, but then she bounced back, and I was like, wow, kids really are very
Yep.
strong. I've always like wondered, like, because kids are so like strong and resilient, to what extent does it change how you treat children in comparison to adults?
Yeah, I mean, there's some disease states, like in some cancers and things, we can actually give higher doses because their
Mhm.
organs are more tolerant of it.
Mhm.
So that's one thing. In some cases, it makes things harder because, like, for a 2-year-old who's just had their tonsils out, and you're trying to explain to them in order to go home, you need to prove to us that you can drink, and all they can think is it hurts back there. They, and as an adult, you'll know, like, okay, I got to power through this, and it's going to get better. But sometimes with kids, they can't. So sometimes we have to approach things differently. Or another example is like with asthma. We know we want their masks to be on so they can get their oxygen and their treatments appropriately, but they don't want the mask on their face. So sometimes we have to use a little light sedation to help calm them down because
Right.
they can definitely experience a lot of anxiety. Yeah.
Yeah. And then
But so much of what I do is like infectious disease or asthma, and we have a lot of really good medications for those things. And again, usually when they come in, that's their only problem, and their body is able to bounce back from
Yeah. No, as a child, I remember when I got sick, I had to get like an IV in my arm or something, and then I was just like punching the doctors and everything. I always
that.
had to be held down with the doctor.
Yep.
Um, I guess like I know you said like family is often included in your rounds and and everything. Is there something that you wish parents or caregivers in general would know more about, like in regards to drugs for kids?
I'm trying to think. There's so many things, but just how to give medications to kids appropriately. The fact that you should not use a household teaspoon, you should use an oral syringe. The CDC actually has a campaign about that, and it's called "Spoons Are for Soup, Not Medicine," right? So, how to use an oral syringe would be a big one. How to measure an appropriate dose with an oral syringe, and just sort of how to give kids medicine. And also, like that, their pharmacist can be a resource in terms of over the counter options for kids.
Does your hospital like hold training for parents?
No, unfortunately, that's
Uh,
a resource thing. I'm
mhm.
the only pediatric pharmacist here.
Okay.
There's just me. So we did just hire a pharmacist to cover our NICUs, our neonatal intensive care unit. So I'm really excited to have a partner over there because I don't have time to go over there. So they have pharmacists over there, but not sort of their own clinical pharmacist. So it's going to be a really great thing to have them. So maybe in the future, once that person gets her feet under her and everything, we could do that. But at this point, it's just me, and I have too many responsibilities right
Right,
now. Yeah.
for sure.
And what is your work-life balance? Because I know like your day in the life seemed really packed and everything. So I was kind of wondering like what the hours were like for you.
Yeah, so I have two kids at home. They're 11 and 13, so they're both in middle school right now. And so my afternoons are definitely driving kids around to places. Um, so because I have this sort of combined position, I have a little more flexibility with my schedule. So like today, I have to drop one daughter's skates off to she's a figure skater, so I have to drop her skates off to be sharpened. And then I have to then she has a choir concert tonight. So I try to put my kids first, and I get here around 7:15 or so. And so then I usually leave by like 3:30 or so, but some days I'm able to just work from home because I'm working on a project and a paper that I have to submit to a journal. Every day's a little different, but I try to leave by 3:30 and I'm home by 4, and so that's one thing I like about this faculty position is sort of the flexibility with it, and that I don't clock in. But it also means that, for example, when last night I was at my daughter's figure skating session, for an hour and a half, I was sitting there on my laptop doing work,
Oh,
So, and that was from 6 to 7:30. So it means I can leave early sometimes, but it also means that sometimes, I'm working off hours also. And because I'm the only peds pharmacist, they contact me 24/7. So, most weekends I'll get at least one or two messages from the medical team with a question or from one of the pharmacists. And, that's just part of the job. Patients have to be taken care of. And I know they try not to contact me if they can help it. And so yeah. But again, I don't mind it. They all have my cell phone number. So.
hmm, yeah. You mentioned like you did like certain projects. If you're able to kind of like what kind of projects do you do, or if you can like explain what those projects are.
Sure. So I've had many students do research projects with me this year. One of my students, he's actually a technician here. He's a P3. He did a project looking at vitamin K dosing in pediatrics because there isn't a lot of good information in the literature right now about how we should dose it. And I know what we do here in practice, but it's sort of made up. And that's how a lot of things are in pediatrics.
Hmm.
So he kind of did a chart review and looked back at all of our patients that have gotten vitamin K and documented, what doses we used and what the response was. So he was able to present that as a poster at the ASHP mid-year meeting a few months ago. And then hopefully we'll be writing it up to submit it as an article for a journal. So that's an example there. I have another student who actually, this is an adult project, but there's an IV form of caffeine that is sometimes used for pain, particularly headache pain. And this drug, I don't even think it's officially approved by the FDA. That's how old it is. It's a very, very old drug.
Wow.
And there's like nothing in the literature about dosing or even how to mix it because it's an IV medication. So again, she just looked back in the literature, and I think we had like 40 patients that we've given it to, and sort of just documented what doses we used, how we mixed it, how did it work for their pain. It's not that great for pain, by the way. I mean, coffee only goes so far, right? So anyway, but then she's been in contact recently, and we're getting ready to write up that to submit that for publication as well. So a lot of times the research and projects that we work on are very like centered on stuff we've done here. So they're very local, right? I'm not in some big research trial, it's just documenting what we do here. But a lot of times I feel like responsible, but like we should be sharing that because, for example, the caffeine one, there's like nothing in the literature. And whenever they call us and they want to do it, like we have to look it up every time and there's nothing. And if we should just be publishing what we're doing so we can share with other hospitals and provide that reference. So to me, I see it as a good opportunity for students, but also sort of our like pharmacy societal responsibility to share with others our experience. So yeah, it's fun, but it's a lot of work, but it's fun. So this is where students can come in and do projects, usually in the P3 or P4 year.
Hmm.
So do you like suggest the topics they work on, or do they like come to you with like topics in mind they want to like research about?
Yeah, so usually we have a list here. So myself and there's several other preceptors here at the hospital. So like I have a little list on my bulletin board in my office where I just like anytime I think of a project idea, I put it on there. So we all have our ideas, And at the beginning of the year, we call it the pitch. We'll pitch our projects to the students who are coming in. So just a little advertisement I want to let you guys know about, and that is the Night Scholar program. I don't know if you've heard about it, but it's a program for P4s at Rutgers, and really want to encourage anybody going into their P3 year can apply. Usually the applications come out like September, October, P3 year. And the idea is the Night Scholars spend their first 4 rotations of their P4 year at the same institution. So the idea is sort of you get that continuity in that first 4 months, really good mentorship because you kind of get to know everybody there, and you do a little research project that you can present at mid-year. So we see it as kind of a mini residency. So not all hospitals participate, but we do. We've been participating for many years, and we always take 3 Night Scholar students every year. And so that's, if students are interested in research, the Night Scholar program is a really great way to explore that. But there's several hospitals. I know like Hunterdon does it. Trying to think, Jersey Shore, Robert Wood just started, Robert Wood Somerset. I can't think of all the hospitals. St. Joe's in Patterson also does it. So it's a really great opportunity for students.
Yeah.
Really quick, sorry, Tyler.
No, you're
Do
good.
you need like prior research experience to like participate in that?
No. Yeah.
Okay.
Some students have it, but it's not a requirement. So
Mhm.
Definitely interested in that. Yeah.
there's more information on the school website too.
Nice. Yeah. But you mentioned like, do you feel like pediatric pharmacy is kind of like a little, not behind, but like there's not that much attention on it compared to like other fields of pharmacy?
I think sometimes we call children therapeutic orphans because there's not as much information on drugs in kids as there is in adults. I think it's getting better. Legislation from the FDA that passed about 20 years ago now requires that any new drugs that come along that are going to be used in kids, they need to actually do studies in pediatrics. And so that's like really, really helped with new drugs. But we still have a lot of old drugs that we use all the time. And there's still a lot of unanswered questions. For me, I like that challenge. That's sort of the, inherent nature of pediatrics, is that we do things a little off book sometimes. Like, when I have a medication that's only available as a tablet and it's a 2-year-old, what are you going to do? Well, I'm going to crush it. I don't care if it says don't crush, because what else am I going to do?
Right.
So it makes you think a little bit outside of the box. So sometimes I feel like we have a lot of the same issues as geriatrics. In that sometimes those patients don't require doses that are different and dosage forms that are a little easier to take than pediatrics. And so that's another age group that is sometimes neglected when we think about drug studies and everything.
Yeah, kind of going off of that, is there anything about pediatrics that you think is relatively like misunderstood in the field of pharmacy?
Good question. Well, I think people sometimes tell me, or I hear this a lot from students or residents that are starting my rotation, that they're always scared of pediatrics. They thought it'd be a lot of math. And I think in terms of just from the pharmacist perspective, yeah, it's a lot of math, but it's not calculus, it's just multiplication. So yeah. And I think too, like one thing that I kind of focus on is like dosage forms and making sure whatever we recommend that the patient can actually take it. Like the other day, we had a patient on a steroid liquid, and I was explaining to my resident that the physician wanted to order this dose that was going to be 11 milliliters. And if we sent the kid home on that, that was going to require multiple, they'd have to, because usually outpatient, they only have 5 and 10 ml syringes. So they would have to go into the bottle multiple times to get the dose. So I asked the pediatrician if we could just change the dose from 11 mLs to 10 mLs, because that's just so much easier for the parents to take at home. And so that's just thinking about what it looks like in the home environment, I think is sometimes forgotten, especially in the hospital. So that's something that I try to really focus on when they're here, so that when they go home, it's an easy transition.
What do you would you recommend students to go into the pediatric world and like work as a pediatric pharmacist or
I find it very enjoyable, but I always caution students that if you're going to specialize like this, just to be aware that you need to be flexible about where you're going to live because there isn't always, like in New Jersey right now, I think there are two pediatric pharmacist jobs open right now, but that's it. And like they're both in North Jersey. So if you were from South Jersey, you're out of luck. So the more you, and not just for pediatric pharmacy, but like for any of the real specialists, you just have to recognize that you may not be able to have your choice of location, at least immediately. Does that make sense?
yeah.
So like I'm from the Philadelphia area, and when I applied for jobs, there was one job in Philadelphia. I applied for a job in Cincinnati, and I applied for Rutgers, and that was it for the Northeast. Those were the only jobs available in the entire Northeast. So, but I was flexible with it. And I knew that was a possibility. So I think as long as students have an open mind and are willing to move around, I think it's a great career. It's challenging, but also very rewarding.
So, I guess since like we're kind of low on time now, just like a really fun question. What's something that helps you unwind usually?
Yeah, I mean, I like sports a lot. I like basketball. This summer, my family, we went to the Olympics in Paris, and we got to see the U.S. women's soccer team win the gold medal. So we really lucked out that we had those tickets. So that was fun. So we like going to sporting events. We're going to the figure skating world championships in a couple of weeks in Boston just to watch. And I like to run. So I enter races and things, a few times a year. So I'm doing because I'm a Philly girl. I'm doing the Broad Street Run in May. So, I always try to have a big race that I'm training for.
Wow.
I'm not that fast. It's just completing it. That's that's the goal.
Honestly,
Get the t-shirt and the medal.
I still applaud you for I could like because I play ultimate frisbee and that is a lot of running, but I can't see myself doing like a race or something like that because it's just that's so much running and I can't imagine myself doing that.
Yeah,
So I
it's a
got
lot, but it's a good running is a great activity, especially like for working adults because you can kind of fit it in anywhere. You
right.
just need your shoes and
Uh-huh.
yeah. Yeah.
Yeah. All right. Well, I think that's a good place to stop. So
Okay.
thank you for joining us on our podcast and for our viewers at home, stay tuned. This podcast will be on our Spotify and our YouTube, and check our Instagram to see for more details.